Well, if you've been waiting for the oral systemic movement to take on, it is happening now. This is the first time we have a university hosting an oral systemic event. We have Lincoln Memorial University Reconnecting Medicine and Dentistry. Yes, you heard me right. You can reverse that, but I'm going to say it again. We have them co-hosting us at the IDM Scholar Society, and they're going to be hosting it at the medical school with, in partnership, the dental school. So that's right, we're bringing the two entities back together, and it's going to be amazing. You're going to hear speakers that you have not heard before and that you can't hear just anywhere else. Right, Dr. Pritchard, we're going to have a lot of fun, but I think this is a really unique experience because people kind of sit back and like, well, I'm kind of waiting to see how this oral systemic takes off.
Yeah, or like happened to me, I kept going to courses on oral systemic year after year, literally for years, and would come back and maybe try a thing or two, but it never took off. Like implementation, we have it built up to be something difficult. And now that you and I are working together, Laura, on patients real time, it's not hard. It's easy. It's enjoyable, better patient outcomes. Like we can't say enough about it. And we don't want everybody to struggle the way that we've struggled to figure this out because it's simple and it's, well, we know it's the not, I started to say the wave of the future, but it's the future here now. In fact, if you're not implementing it into your practice, then you're not really doing the very best for your patients. It's just the truth. And you could have a better improve your bottom line. We're going to talk about all of that at the symposium, bringing together several different disciplines and several different specialties within dentistry, several different specialties within medicine, to come together and actually talk about cases and talk about boots on the ground. How did we do this? How are we doing this? What did we learn? Don't do it that way because it doesn't work. So what does work? What doesn't work? How to make money at it? And most importantly, how to save lives. And there's no other symposium like it. And as everyone knows, probably that's listening to this, and if you don't, I'll tell you that we had the first IDM annual symposium last year, and it was a huge success, rave reviews, and everyone said, we'll be back. And now it's even better. We're doing all of that and more, combining it with the university and with both the medical school and the dental school. It's going to be very exciting, and you're going to be so glad you came. And I say so glad you came, but Laura, I'm even more excited that for those who absolutely cannot, there's a virtual option. So we're going to have an equally engaging online live streaming with an active chat and live access to the support team, etc. So even if you can't get away, get this on-demand course. We hope you can come because, of course, everything's always better when you're actually there and networking and in the room and meeting with people and visiting all of our fabulous sponsors, which we'll talk more about later, our partners, if you will. And that list is still growing of the partnership involved. Anyway, it's going to be a symposium you don't want to miss, whether you can come, first choice, or join us online. It's going to be well worth your time and money. And I'm sure that the recordings will be available too. We haven't talked about I don't know the price of that yet, but definitely the recordings will be available if you want to show it to your team later, because it's going to be that practical.
Well, and of course, I'm a fan of experiential. So I always say coming and just experience being there. A lot of it's just the communication you have on the side that you don't get to have just by being online. Obviously, if you can't get there, online's a great choice. But there's nothing like being able to talk, to that person next to you. And it's really about networking, people who are already doing this. So hearing the strategies, hearing what works, what doesn't work, and just what I'm talking about, this whole trend that we have a university that is taking oral systemic and putting it into practice and be able to see what is happening on the cutting edge of what is taking place. The other thing is, this is for you. I say, if you've been kind of sitting back and you're like, hey, I say, improve my income, improve my practice, improve my patients' overall health outcomes. This is for you. This is truly going to give you some practical strategies, the tools, and you're going to get to see how we are implementing this in different arenas and different practices. So from the medical side, I know we've got MDVIP there. They're going to be showing us, we have a cardiologist coming in. Of course, Dr. Pritchard, you're being hosted on there. But I think the whole second day is like physician dominated. And I just have to say, whoa, that is just something to be able to focus on how are they connecting to dentistry from the physician side, and then vice versa, being able to look at that from the dental component. What are we doing in dentistry? Who's out there? Who's the movers and shakers that are actually making this happen? And we used to call it collaborating, and really we're talking about reconnecting, right? It's beyond, hey, communication and collaboration. We're talking about merging those back together and reconnecting medicine and dentistry. And if you've been sitting on the sidelines, then this symposium is definitely for you to get reconnected and to boost your practice.
One of the things that Laura and I want to talk about is this subject of terminology, because you've heard us, if you've heard us speak at all, at least once during the presentation, I'm sure Laura and I said referral is a dirty word. It is. Referral is a dirty word. Like whenever I hear that come out of somebody's mouth, I know nobody means it in any kind of way. And we've all had it in our vernacular for many years. But now it's oral systemic collaboration. And that's starting to irritate me as well, Laura. Don't you think so? We've talked about it because it's kind of like referral. It sounds good, oral systemic and collaboration. That sounds good. And yes, that's what we're talking about. But until you reconnect the way it was meant to be all along, we're not reconnecting the body the way it was meant to be all along. It is one human system. The mouth is part of it, the nose is part of it, the airway is part of it, the head is part of it, the heart is part of it. It's kind of crazy to have this kind of conversation. And maybe I'm being picky, but we've seen people struggle for so long that we want to set aside as archaic some of these old terms. Referral. No, we're not using that word anymore, because when we refer over there for that part of the body, it's still bidirectional. It's still this part and that part. That's not what we're talking about. We're talking about colleagues, professional colleagues coming together to merge our care plans for this patient in front of us to treat the whole body. So I love that Dean Denise and Deb Bridges and others have spent a lot of time thinking through this, the title and the wording and the speakers and the content. And it's reconnecting dentistry and medicine the way it was meant to be all along for the tagline, totality of care. We've gotten way too far of seeing this doctor, the podiatrist for the toe that hurts, and the GI doctor that specializes in your gallbladder for the gallbladder. But oh, if it's your liver, don't see that GI doctor, see this other one. Pulmonology has become that segmented. You can't just go to a pulmonologist. You have to go to the pulmonologist that specializes in your pulmonary problem. In other words, we all understand how it historically evolved, but that's over with AI technology, with data at our fingertips, with algorithms at our fingertips, and our science changing literally every week. We learn new ways to treat some of these complexities that we're dealing with. And so, Laura, what else would you have to say about that? This is totality of care, reconnecting dentistry and medicine to treat the entire human system and the leaky syndrome.
Absolutely. And I think this thing is learning the strategies around the leaky syndrome. But I have to take us back is that I think most of us can feel that pain, can feel that problem, that we've been like isolationists. We keep isolating more. And that's really happened to us on both sides. So we feel very isolated. And to me, this is the solution, is getting us all in the same room, getting us to a symposium, talking about what strategies are working to get us to reconnect and working together. And so not only will we feel less isolated, our patients are going to feel less isolated. And the biggest thing is we keep saying, you're going to get healthier patients and healthier practices. Doesn't matter on which side you are, dentistry or medicine, we both struggle in our practices because this is a huge problem. And this is the number one solution that we can help you with. And then just watch, I say, life. We've got to help each other out in life, the stress, the chaos of running a practice, right? This really kind of squelches things down because it is truly reconnection and a partnership. And so I feel like the symposium really has a lot of answers, and that's going to have a huge impact on so many people's practices, but much larger than that, all the patients' lives that it's going to touch.
Yes, it is. So bring your whole team. And if the whole team can't come, then please bring at least yourself, maybe yourself and one other. We think it's fantastic if a MD or a DO and the RN in the office, or medical assistant that perhaps is the care coordinator. And then in the dental office, the dentist, the dental hygienist, uh, dental assistant, the front office, the more that people that you can bring, the better. But even if you can come as a dental hygienist, come as a dentist, come as an RN, as a health coach, as an MD, as a DO, as a nurse practitioner. It's for a nutritionist. It's for physical therapist. It's for chiropractic. It's for myofunctional therapy. There's going to be something for everyone because it's that broad in our interdisciplinary approach, but we're bringing all of that together for the care of the patient. And as Laura said, for healthier practices as well. So we hope you'll join us. You don't want to miss it. We were excited last year, Laura, but this is going to be the answer to what our colleagues have been looking for, even more so than last year, as great as it was. And we all learned so much, and it changed my practice. We keep hearing about stories from last year, but this is taking it up a notch, I would have to say, in so many levels.
And we do have a couple repeats. I know Dr. Nathan Bryan's going to be our keynote speaker. We're going to have the airway revolution. Airway is such a big, huge piece of this and overall health and well-being. But like you said, there is something for everyone. And I think that's what's really important. And that's truly what gets us networking and working together, is that we start to see the similarities and then seeing the strategies and the tools that really connect us. So I hope everyone will join us May 17th and 18th. It will be held at the Lincoln Memorial University right there in Knoxville, Tennessee.
We'll see you there.